I'll make it very short. Can you open it? Good afternoon, all. I'll be talking on maintaining a logbook. Logbook are introduced in clinical education to enhance and monitor students' learning. But clinical experience shows they're not always optimally employed. In the next few minutes, I'll be trying to share my experience on implementing the logbook. Why do we need it? The quality of any clinical training depends upon multiple factors, the important one being the number of patients and also the educational expertise of the trainer. No two trainers are exactly the same. So to ensure consistent quality and standards in the learner's experience at multiple level of training, logbooks are employed. What are they? They are nothing but a set of learning objectives for the specified educational time period. So the learner will be already aware of it and know what to do. So this keeps them better engaged in the learning process and it improves the structure of the training. It's not moving. Okay. This is the page what we had in the existing logbook where they enter the pre-op details, the operative notes, and also note the complication and the post-op visual acuity. This looks overall good, but the downside of this is repetitive writing of the same operative notes again and again unless there is any intra-op deviation. This makes it very boring and less engaging, and until and unless it is monitored and mentored, they're not going to fill it in first. And again, though the details of complications and visual acuity are entered, it does not provide any opportunity for data analysis. And the important thing is, by looking at this, I'm not able to assess the performance of the trainee. So I designed and implemented a structured logbook to aid learning and training adapted to the student's need. When I designed, I kept it certain points in my mind that it should be very simple and handy, the contents to the point, and presented in a clear structure, exactly defining the learning objectives. It also should allow for easy data entry and analysis. In short, it should be both a comprehensiveness and simplicity should be there. Always make the content of the logbook should be constructively aligned with the curriculum. That means the learning objective of the curriculum and the learning outcomes of the logbook should always correspond. Our cataract surgery learning curriculum starts at the 4-month of the for SICS once the trainee picks up the comprehensive ocular examination skills. In the final year, they learn to perform phacoemulsification. So the contents of the logbook were listed such that it mirrors the activities, whatever they do in the wet lab and inside the theater. At the beginning, any trainee is introduced on the benefits of using a logbook so that it keeps them engaged. They are asked to submit them weekly to get a better feedback. So it gives both of us a quite overview of the requirements of the training and idea of the learning process. They also attend a series of lectures and write modules from basic anatomy to the complex IOL per calculation. This will be covered in a month and their attendance is documented. They also spend a considerable amount of time in wet lab, 2 to 4 hours, where they practice to use the operating microscope, develop the hand-eye coordination, and practice suturing skills, sclerocorneal tunnel construction, and rhexis. And for phacoemulsification, they perform nucleotomy technique in the wax eye or the frozen nucleus obtained from SICS. All this curriculum is documented and always supervised by a senior surgeon. So this is perceived as a trigger for learning. And this training is not a fixed session. Even after entering the OR, if they learn to enhance or improve their surgical skills, they should never hesitate to go back to wet lab and do the same. All this exercise which has been documented so far imparts a right attitude at the beginning of the training, emphasizing that the patient needs and their care comes first before their training. Once this is done, after 4 to 6 weeks, I sit one-on-one with the resident with this questionnaire on various aspects covering for both SICS and phaco. So this encourages them to think on the various aspects of cataract surgery and learn and prepare themselves. In the end, it gives me 2 inputs, whether the minimum requirements of the training is fulfilled or not, if any learning objective is not accomplished, to set a learning plan and work towards it. All this acts as a collection of documentation of evidence that learning has taken place, depending upon which I can decide when a surgeon is starting his or her first case. Once they start operating, they document the stepwise analysis, visual outcome, complication rate, and also the surgical audit. In the stepwise analysis, they document for an individual case what are the steps done by them with help or independently or not done at all. How is this going to help us? It shows them their own learning curve by scrutinizing their own cases. So it serves as a good guideline and prevents them from falling back. It compares themselves with themselves over time, and with the constant feedback, they are going to show improvement in the future. This gives a complete picture of the learning accomplishment and encourages a self-directed learning. I encourage all my residents to make a bookmark in the electronic medical record so that a patient comes, they will be directed to them directly. So they'll be seeing the patients. So doing this post-op follow-up and tracking the outcomes helps them in many ways. One, it tells them how well they are performing, and it tells what is the level of trauma or inflammation they are caused in the eye. And third, understand about the surgically induced astigmatism and also know about the biometry and IOLPA calculation. They also enter the complication rate month-wise. When faced with a complication, always as a trainer, our role is to give a constructive feedback, what went wrong and what they could have done differently. They also record their cases and do a surgical audit. Depending upon, for every step, they note the time and areas of improvement. This exercise encourages them to know what are the best part of the surgeries, what are the areas they need improvement, and also enhance their critical thinking aspect and hence their surgical performance. They document the same here. So the quality and the nature of exercise, whatever I have described, is the same thing that they're going to carry into their future career. So getting this habit very early part of the training is really essential. And they also know to keep a data and do an audit. All of this has implication in their professional career. Though all of us agree, and many students also agree that logbooks are useful in their training, few don't. This is because logbook always are flawed because of two reasons. One, if the structure is not adequate, where it acts only as a burden of data entry, so they're not going to do it. They're going to just fill it because it is mandatory and not just because it is useful for their learning. And again, if it is not mentored and monitored, it's going to be incomplete. So our role as a trainer is to identify their mistake, give a quality feedback, and help them climb the steep learning curve very easily to become the surgeon of highest type. So to conclude, logbooks improve the structure of training and helps the students demonstrate a learning progress and accomplishment of the learning objective. Thank you.